And also, if you have a question and do not want to appear in the video, which is very understandable if you look at me in the seat, then you always can keep the camera off. But other than that, we will open the video and the mics if you have questions during the question and answer session that we will have later today. So we are really open to interact with you and make it as interactive as possible. Yeah, and I forgot to say that we also will share the slides, obviously. So video and slides will be shared later. You can always follow up. Yeah, if you have a question, if you want to interact in one way or the other, can you stay with me? Yeah, thanks. Yeah, turn your video on if you want to, so that we can see you. But of course, obviously, turn on your microphone if you have a question. And we are really happy if you have a question, a comment, also criticism. We are very open, I think, a very open group. So we welcome everything that comes to your mind while we talk. And of course, always later. Yeah, it would be very helpful for us if all of you who are here could present yourself quickly in the chat, who you are, from where you, which organization you come from, your contact details, if you're happy with sharing that, and maybe what you think you can offer, and also what you would expect from this interaction. So to reflect a bit both sides would be, I think, helpful for us to design this cooperation as good and as valuable for everyone. So if you, the ones who are here already, could do that whenever you want during this webinar, I think that would be very helpful for all of us. Yeah, and also please spread the word, of course. We are always happy to enlarge this group. The more we are, the better, and the more views we get. So this is, I think, also something we would like to invite you. For questions, if you do not, for whatever reason, want or can interact verbally with us, you also can use the Q&A section, not the chat. The Q&A section that will be monitored by my colleague Vinay to ask a question, to comment, and we will try to pick up the question during the webinar. If possible, if not, we will look at the questions later, see whether they have been answered on the slides already. If not, we will, of course, send you an email or another message to respond to your question in case we did not have the chance to discuss that question during the webinar, because time is always short and precious. What we will also do is if there are new questions that are not already on our FAQ page on the website, we will add them to this so that everyone has the chance to see the answer to a very relevant or new question that occurred during the webinar. Yes, and we always invite you, especially for those who are in this webinar, because it is an open webinar, who are not yet registered as a official follower to suHCO, that you can become a follower. That is low threshold in the first place. The first, I think, incentive I can tell you is that you will be contacted by my colleague Vinay. We will ask for a logo. You will appear on the suHCO website as a follower, and then of course we will have a bit more the chance for more detailed interaction with you. And also, if you are interested, register to the newsletter and follow us on LinkedIn. Now the next slide. Sorry, I was talking a bit too long. Yeah, I think I will summarize a bit what the idea is of this event today. So first of all, because it is the first event, we will present, and that is my colleague Maria, you a bit the scope of the project, what we do, what our objectives are, but also what our challenges are, and challenges, I think we mean it in two ways. One is the challenges we do have when we implement the project, but also, of course, how we define our common challenge that we will publish as part of the tender documents that will be published very soon, to tell the market what we are looking for, what the challenges of the procurers that are involved in suHCO, and how we would like the market to address that challenge. Yeah, we also share a bit of our ideas what the suHCO solution should be able to do in the end. Of course, we are not the ones that are defining the solution in detail, but we, of course, are the ones who are defining what kind of functionalities we would like the suHCO solution to have, what we are missing in the market currently, things like that. Then also our ideas of what the follow-on network is about. And here especially, we are, of course, also happy to receive your ideas of how we can jointly design this collaboration. And then this webinar is also intended to tell you a bit more about our idea of developing or improving existing taxonomies in the area of sustainable healthcare. That will help us as the demand side and also the supply side in understanding each other a bit better, I would say. We will tell you a bit more about our Taxonomy Working Group that we are going to launch and how we are envisaging the collaboration in that regard. So I think, that's my last slide. We have a few colleagues who will be presenting today. First of all, and most importantly, Maria from Consorci de Salut in Catalonia, from CSC, who is the project manager of this project. So she will present the suHCO project and also what we are having in mind in relation to the suHCO solution. You have seen me now, and I will stop talking in a minute. I'm Sonja from Empirica. I'm a project manager at Empirica and supporting the suHCO project in many different ways. And last but not least, Marlene Grauer from BMI in Germany, also very experienced in procurement and innovation procurement, and she will take over the part of the taxonomy mainly in this webinar at least. Next slide. And I think with this, I hand over to you, Maria. Is that correct?
Yes. Just give me a second that I will take control of the presentation. Okay. Thanks, Sonia, for the introduction, and good morning, everyone, and welcome to this first event of on behalf of the suHCO consortium. I will like to introduce you to the project itself now. So the project is made up by a consortium, and itself the consortium reflects that this is a multidisciplinary challenge. At the center of the project is the buyers group, composed for 3 procurement organizations representing different European health and care systems. First, we have CSC, which I representing Catalonia and Spain, and we support a large network of health and care organizations through centralized procurement, and we have over 130 members at CSC. We also have Enea in Treviso, Italy, contributing to the experience of the long-term care sector in Italy with 4 nursing homes, patients at home, daily care centers, a co-housing and educational institute. And we also have the UHB in Wales, UK. They plan and provide NHS healthcare services with 4 main hospitals, 5 community hospitals, 2 integrated care centers, and a wide primarily community network including 47 GP practices, community pharmacies, dental, ophthalmic, and other community settings. On paper, these organizations appear very different. They operate under different regulations, different funding models, different governance structure, different healthcare priorities. Yet, when we compare the results of our preparation activities, the similarities were striking. Also, supporting the BioRx group, there are 3 organizations with complementary expertise. First, we have Empirica from Germany, contributing with extensive experience in innovation procurement and European Digital Health Project. We also have the Bevan Commission from Wales, UK, which bring expertise in healthcare innovation and service transformation. And last but definitely not least, we have BME from Germany as well, contributing its long-standing experience in procurement, supplier engagement, and circular economy. Altogether, this combination of expertise allow us to look at the challenge from multiple perspectives. Now what I would like to follow with a project overview. And now that we have seen who is behind the project, let me explain what suHCO is actually about. So suHCO is a Horizon Europe pre-commercial procurement process. This means that instead of purchasing an existing product, we are investing in research and development to stimulate the market to create innovative solutions that do not yet exist. And to do so, we have been granted 2.86 million euros. The project brings together, as I mentioned, 3 healthcare procurers that, despite operating in very different healthcare systems, I identified an almost identical challenge, which is supporting the sustainability transition of health and care organization. This might sound like a very broad goal, a very broad objective, and in many ways it is, but it reflects the reality that health and care organizations face nowadays. I would like to say that sustainability is no longer an optional initiative or something that can be delegated to a single department. It is becoming a strategic objective that influences procurement, facilities management, clinical practices and infrastructure, reporting obligations, and long-term organizational planning. And at the same time, expectations continue to grow. And in healthcare organizations, they are expected to reduce their environmental footprint, comply with an increasing number of regulations, improve transparency, report on sustainability performance, and make better use of resources. All of this while continuing to deliver a safe, high quality care. This is an enormous challenge. And rather than asking a simply question to become more sustainable, suHCO wants to ask a different question, but rather, how can digital innovation genuinely help organizations make better sustainability decisions? And this question has become the foundation of the project. Before discussing technology, I would like to pause for a moment and reflect on why this challenge matters. Healthcare exists to improve people's health, yet paradoxically, it also has a significant environmental impact. Nowadays, healthcare is responsible for approximately 5% of global greenhouse gas emissions. It also is responsible for a large amounts of waste that are generated every single day. An important share of that impact comes not from hospitals themselves, but from the products and services that they purchase throughout the supply chains. The image that you find on the right-hand side of the slide, probably you have already seen it, but it shows that waste generated during a single medical procedure, a single surgical procedure. And what makes it particularly striking is the sentence that you find underneath the image, which says that there is not even the packaging is showing on the image. In other words, what we are seeing is only part of the picture. This image is not intended to suggest that healthcare professionals are doing something wrong. On the contrary, patient safety must always remain in their first priority. Many of the materials shown here exist for a very good clinical reason. The real question is whether there are opportunities to reduce environmental impact without compromising quality of care. Can we make better procurement choices or decisions? Can we improve resource efficiency? Can we identify alternatives supported by evidence? These are exactly the kind of questions that motivated this project, the suHCO project. On one of the first conclusions that we reached during the preparation phase of this project was that sustainability cannot be addressed through an isolated initiative alone. Across Europe, there are already many excellent projects. These initiatives are extremely valuable. However, organizations repeatedly told us that their biggest challenge was not the lack of individual solutions. Their biggest challenge was connecting everything together. Health and care organizations do not experience sustainability as separate projects. They experience it as a complex organizational challenge involving many different departments, professional profiles, and decision-making processes. That is why suHCO deliberately takes a horizontal approach. Rather than focusing on one product category or one environmental issue, we focus on the organization as a whole. We want to support collaboration between procurement professionals, sustainability managers, clinicians, facility managers, finance departments, and senior leadership. Because sustainable decisions rarely belong to just one person. They emerge from collaboration across the organization. And this organization perspective is one of the defining characteristics of the projects. And we want this solution to help all health and care employees. We want this solution to connect with healthcare decision makers. We want this solution to empower HCOs of any kind and any size, and we want this solution to make sustainability actionable. So we want to explain as well the suHCO aim and scope and what do we expect from suppliers. We've detected 4 different areas. And when analyzing all the evidence collected during the preparation phase, these became what we now call the 4 building blocks of the suHCO challenge. And the first block is information. We've seen that health and care organizations need easier access to trustworthy knowledge. Not more information, but better information, reliable, contextualized, and relevant to the decisions they need to make. The second building block we've detected is operations, and we feel like health and care organizations need support to transform sustainability strategies into concrete actions. Many organizations already have ambitious sustainability plans, but the challenge lies in implementing them consistently across everyday operations. The third building block is organization. Sustainability depends on collaboration. The future solution should therefore facilitate communication, knowledge sharing, and coordination across departments and different professional roles. And finally, the fourth building block we've detected is change and upskilling. Digital tools alone do not transform organizations. People do. So healthcare professionals need support, need guidance and confidence to integrate sustainability into their daily work. These four building blocks do not describe software modules. They describe the capabilities that healthcare organizations told us they needed. Everything else in this project, from the use cases to the evaluation criteria, has been built around those four building blocks. Before defining the requirements for the future procurement, we asked ourselves a very simple question. Who are we actually designing this solution for? It may sound obvious, but health and care organizations are incredibly diverse. Sustainability means something different depending on your role and kind of organization. For example, a procurement professional is thinking about tender specifications, supplier engagement, and life cycle cost. A sustainability manager is trying to coordinate initiatives across the organization and monitor progress against strategic objectives, for example. A clinician is primarily concerned with maintaining safe, effective, and patient care while reducing unnecessary environmental impact. And for example, senior management needs to make investment decisions, balance competing priorities, and ensure compliance with an increasingly demanding regulatory landscape. These are very, very different perspectives. If we designed a platform that treated every user in exactly the same way, it would almost certainly fail. That is why we adopted a user-centered approach from the very beginning. Rather than thinking about organization in abstract terms, we identified different people who will eventually interact with the future solution. In this slide, we show you seven different personas that we've created for those different professional profiles. They helped us understand not only what information each end user needs, but also how they work, what decisions they make, and where they encounter obstacles. For example, a procure officer may only interact with the platform during the preparation of a tender, whereas a sustainability manager may use it every single day to monitor progress and coordinate activities across multiple departments. And this difference actually matter. Ultimately, we are not designing technology, we are designing support for people. And keeping those users at the center of the project has been one of the guiding principles throughout the preparation phase, and it will continue to guide the procurement itself. So now I would like to present to you a different results of different activities that we made. At the beginning of the preparation phase, each procurer carried out a different focus group and survey involving healthcare organizations from different countries from the procurer sites. Although every organization has its own context, the results revealed remarkably consistent picture. Here in this slide, I show you the results of the survey, and the first finding of the survey was that sustainability is already recognized in most organizations as a priority. However, organizations consistently identified a number of barriers that slow down implementation. Limited financial resources and limited time were the main barriers identified. Also, difficulty accessing practical and reliable guidance. What we found particularly interesting is that respondents rarely asked for more strategic documents, but instead they asked for support to help them act. They were looking for practical tools that facilitate decision-making, simplify access to knowledge, and help transform sustainability and ambitions into everyday operational practices. This fact reinforces one of our initial assumptions. Another important observation was that the diversity of the organizational maturity. Some of the organizations that participated in the survey had already leading ambitious sustainability programs. Others are only beginning their journey, or they even haven't started. Any future solution, therefore, needs to be sufficiently flexible to support organizations regardless of where they currently stand. That scalability became another key requirement for the future procurement. I would also like to share with you the results of the different focus groups that were held. This discussion brought together professionals from different disciplines, allowing us to explore the challenges in much greater depth. The biggest barriers were rarely technological, but instead they were, I would say, organizational. Participants spoke about fragmented responsibilities, about departments working independently, about uncertainty regarding regulation and sustainability claims, about difficulties identifying trustworthy information, and perhaps most importantly, about the challenge of translating strategic ambitions into concrete actions. Another interesting insight concerning organizational culture is that many participants explained that sustainability initiatives often depend on a small number of highly motivated individuals. And if sustainability depends on individuals rather than organizational processes, progress becomes difficult to maintain over time. This reinforces our conviction that the future solution should support not only information management, but organizational learning and collaboration. Participants also described what they would actually find useful, rather than only dashboards displaying endless indicators. They wanted guidance, recommendations, practical suggestions, support in deciding what to do next. And people do not need another system that tells them what they are. They need support in understanding where they should go and how to get there. That insight influenced many of the requirements included in the challenge brief. And all of this evidence helped us define a much clearer vision of the type of innovation we are looking for. Perhaps the easiest way to explain that vision is by saying what we are not looking for. We are not looking for another isolated sustainability application. We're not looking for a platform that simply aggregates documents. We are not looking for a solution that addresses only one product category or just one environmental issue. Healthcare organizations already have access to many specialized tools, and creating another one would add complexity rather than reducing it. Instead, we are looking for something that helps organizations connect knowledge, people, and processes, a solution capable of supporting different professional roles, different organizational structures, and different levels of sustainability maturity. And scalability is another essential requirement. The future solution should not only work for the 3 procurers participating in the project. It should have the potential to support healthcare organizations across Europe. And finally, a word about AI, about artificial intelligence. AI is naturally attracting considerable attention at the moment, but within suHCO, AI is not our goal, is not our objective. It is simply one possible mean of creating value if artificial intelligence can help users access information more efficiently, or understand complex legislation, or compare different options, or even generate evidence-based recommendation, then it becomes a powerful enabler. Our focus is therefore not only technology for its own sake. Our focus is on solving real organizational problems. Developing a solution with these characteristics requires a wide range of expertise. This is not simply a software development project. It combines healthcare, it combines sustainability, procurement, data management, user expertise, AI, as mentioned, and organizational change. For that reason, we expect many of the strongest proposals to come from multidisciplinary consortia bringing together complementary capabilities. Technical excellence will obviously be important, but technical expertise alone will not be enough. Suppliers also need a deep understanding of healthcare environments. They need to understand procurement processes. They need to appreciate the complexity of sustainability decisions, and they need to think beyond that, beyond the duration of the PCP itself. One of the strengths of the pre-commercial procurement, the PCP, is that it is designed to stimulate future market uptake. The ambition is not simply to complete a research project. It is to create innovative solutions which are capable of reaching the market and generating long-term impact. This brings me to one of the key principles underpinning the entire procurement. suHCO is deliberately technology neutral. As procurers, our role is not to tell suppliers how to build the solution. Our responsibility is to define the challenge as clearly as possible, to describe the outcomes that we want to achieve, to establish the functional requirements, and to define transparent evaluation criteria. Everything beyond that is an opportunity for innovation. Different suppliers may propose very different technical approaches. Some may rely heavily on AI, others may focus on semantic technologies, interoperability, or even knowledge management. Some may combine several technologies in ways that we have not yet imagined. That diversity is precisely what makes a PCP so valuable. Rather than selecting the best implementation of the predefined concept, we create a competitive environment, which we'll go through in the next slide, and we'll explain it in the next slide, in which different ideas can be explored and compared and progressively redefined. Ultimately, what matters is not how suppliers solve the challenge. What matters is whether they genuinely help HCOs, health and care organizations, to make better sustainable decisions. And now that we have explored both the challenge and the type of innovations we are seeking, let me explain how this innovation process will take place. So this pre-commercial process will take place. The next question is natural: how will that innovation actually be developed? The answer lies in the structure of the PCP itself. Unlike a traditional public procurement where an organization just purchases an existing solution, a PCP is specifically designed to stimulate research and development. It allows public procurers to work to work with the market to address challenges for which no satisfactory solution have yet been created or currently exist. This approach is particularly well suited for suHCO because we are asking the market to rethink how digital technologies can support sustainability across the whole organization. The PCP is organized in 3 competitive R&D phases. We are currently completing phase 0. During this stage, we have worked closely with healthcare organizations, with suppliers and other stakeholders to better design the challenge, to understand user needs and prepare the procurement documentation, the tender documents. Today's event is also part of this process, and every consideration helps us refine the vision before launching the tender. The next milestone is to publish or to launch the call for tenders. And this process will be taking part during the next 3 months and will end by October 9th. Following the evaluation of the proposal sent out during these 3 months, we will enter the different phases of the PCP. The first phase will select up to 4 suppliers. We've recently changed this. We will have up to only 4 suppliers where they will develop the concept design of their solution. The objectives here is not to produce a software immediately yet, but to demonstrate that the proposed approach is technically sound and feasible and capable of addressing the challenge. The most promising suppliers of this phase will jump to phase 2, and will only 3 suppliers will be selected. In this phase, they will develop a functional prototype. This is where ideas start becoming tangible and where the buyers group can begin evaluating different technological approaches. At the end of this phase, 2 suppliers will be selected to further explore their solutions into phase 3. During which their pilot systems will be validated in real healthcare environments, and that will be a real suHCO per procurer. This progressive approach is one of the greatest strengths of a PCP. It creates competition throughout the process, encourages continuous improvements, and reduces risk for both procurers and suppliers. And equally important, it provides suppliers with regular feedback from the organizations that will eventually use this solution. And throughout the preparation phase, one message became increasingly clear, which is that although only 3 organizations are formally procuring the innovation, the challenge itself is shared by hundreds of health and care organizations across Europe. It therefore made little sense to develop the project alone in isolation. And from the very beginning, we wanted to create a broader European community that could accompany the project, challenge our assumptions, contribute to new perspective, and ultimately help maximize its impact. That community is what we call the suHCO follower network. For us, the follower network is not simply a dissemination activity. It is a way to ensure that the project remains connected to the wider healthcare ecosystem throughout its lifetime. Because innovation is always stronger when it is developed together with people who will eventually use it. Healthcare system differs, regulations differs, organizational structures differ, but many of the underlying sustainability challenges are remarkably similar. So the follower network gives us the opportunity to learn from these different contexts and ensure that the feature solution is relevant well beyond of these three procurers participating in this project. So what does it actually mean to become a member of the follower network? In practical terms, it means becoming part of the conversation. Members receive regular updates on the progress of the project, the upcoming procurement milestones, and future opportunities to participate in workshops and collaborative activities. But the relationship is not one directional. We are not simply just sharing information. We are inviting organizations to contribute. Throughout the project, followers will have the opportunity to validate ideas, provide feedback, participate in discussions, and share their own experiences. That contribution is extremely valuable. No consortium, regardless of its expertise, can fully represent the diversity of the European healthcare. Every organization brings a slightly different perspective, different procurement models, different sustainability priorities, different even regulatory environments. And all those perspectives help us strengthen the project. The network also creates opportunities for collaboration between members themselves. One of the things we hope will emerge from today's event is that organizations begin talking to one another. Perhaps you will discover that another organization has already addressed the challenge you are currently facing. Perhaps new partnerships will emerge. Perhaps future procurement collaboration will begin through a conversation like today's. That would be an excellent outcome. And finally, becoming part of the follower network also means preparing for the future. By following the project from an early stage, organizations will already have an understanding of the rationale behind the future solution and the evidence that shaped it and the way it has been developed. So this will make future adoption significantly easier. And I would like to go to my last slide. And before concluding, I would like to briefly acknowledge all the organizations that have already decided to be part of this follower network, to join the follower network. And we are extremely pleased to see how quickly the network has grown since the launch. And we can happily share that for now we have 36 members of the follower network from suHCO. It already includes many kinds of organizations, from healthcare providers to procurement organizations, innovation agencies, even other initiatives or European projects. This diversity is one of the network's greatest strengths, I feel. Every organization contributes with different knowledge and different experiences and different perspectives. Together, they create a much richer innovation ecosystem than any individual project could achieve on its own. However, we also see today's event as a new beginning. We hope today many of you who are attending for the first time will decide to become part of this community, because ultimately the success of the suHCO project will not only depend on the quality of the solution that is developed through the BCP, but also the community that supports it. A strong community means better requirement, better validation, a greater dissemination, faster adoption, and ultimately a greater impact for the health and care organizations across Europe. I would therefore like to invite you to stay involved, to participate in future activities, and help us shape this journey over the coming years. Thank you very much for your attention. And now, Sonia and Marlene, the floor is yours.
Thank you, Maria. We are a choir. I think I suggest we stop here for a minute, maybe, to give participants the chance to ask questions, raise whatever issue comes to mind. And I know it's warm, I think, in most of the countries across Europe. I cannot see anything in the FAQ section as of yet, but yeah, feel free to either put a question there or to open up the mics and the camera and ask a question live. Either is fine with us. If there's nothing so far, I suggest that we continue, Marlene.
Yeah, and I just tested whether I successfully took over control of the slides, and I did. It seems so technology is working with us. That's great. And indeed, we are experiencing quite the heat wave here in Germany, and I think in other countries as well. So my internet has been cutting out as well. That's why my camera stayed off for most of the while Maria was talking. So you let me know if my sound is bad or anything. I'll turn off my camera and then, yeah. But for now, I want to give you a quick overview of another facet of the follower network. So Maria already presented the activities and sort of the input that the follower network can have into the suHCO challenge and the PCP process. And alongside that, not necessarily all of the members of the follower network, but some, if you are interested, can participate in this Circular Economy Taxonomy Working Group. It's a very long name, but for short, it's a Taxonomy Working Group. And I'll give you an overview now of what the idea of this working group is and what we are hoping to achieve with it. Wait, I think I just have to click on the slides. Okay, that works as well. So for the Circular Economy Taxonomy Working Group, just a bit of background. Obviously, the entire suHCO solution is based on a view of circular economy and an ambition towards a circular economy. And that contains a lot of different facets and layers. And we want to explore those layers and also, let's say, cluster them and publish them and make them available to other buyers, other suppliers, and of course also to the potential solution providers of the suHCO solution. So we will start out with some working group meetings, some of which may be part of the follower events, follower network events. And through these working group meetings, we will define a core terminology of the taxonomy that is associated with the challenge. We will identify associated data sources. I mean, Maria mentioned that AI is not a pure necessity of the solution, but can certainly be one. And in any case, even if the solution is not AI driven, it will certainly need some form of data source to be fed into to produce the outcome that we want. So we need to identify the data sources in a hospital and the formats and the indicators and everything associated with it, and the interfaces needed that would enable such a solution. So we have a common working language and a common working ground when speaking to potential suppliers, but also for the suppliers to be working on the prototypes. And with this core set of data sources, there's possibly also a core set of standards and protocols that's associated with it. There is not a one single standard that we can refer to in this case, but there's a couple of them, and we need to identify which ones are the most appropriate. We will do so in a couple of working documents. Actually, we have already, as a first step, sort of as a basis for this working group, developed a first set of taxonomies from which we can start the work. That has been more of an internal activity for now. But over time, these working documents are meant to become official documents, a white paper that can be used by suppliers and buyers as a reference document, and also a document that we can move on towards policy makers and decision makers to use in terms of standardization of this kind of solution, because this is something that is really missing at the moment, right? We don't have an official definition, what is the circular economy or what is associated with a good circular solution. All of these things are up to us at the moment. So we're trying to contribute there in a bigger sense. I think I've said some of this already on the other slide now. So the scope of the working group is to identify those core terms, those core data sets, those core protocols, to clarify if the existing ones are already enough, right? If we can, or if there's big gaps that we need to address and that we need to highlight towards decision makers. Oh, wait, how can I? There you go. To achieve a common understanding of what we mean with those, like circularity, all of those terms that we are using as part of the suHCO challenge, and then that are associated with the potential development of the solution. And we can begin to test solutions and prototypes in accordance with the taxonomy that we have developed. And that works towards the goal of the working group. The working group will sort of follow, and this will be the next slide as well. The working group will follow the path of the PCP and continue to sort of lay the taxonomy work that we've done against the solutions that are being developed, checking not necessarily that the solutions are, let's say, fit with the taxonomy, but whether our taxonomy is doing the right thing, and whether it needs adjusting. And this also is the brackets here is like, are there any adjustments that we need to make, any gaps that we desperately need to address, right? And finally, I said this already, we want to prepare documentation that we can move towards policymakers, especially at the European level, where they have like a broad mandate to do this. And we want to apply these taxonomies across our demonstration sites with our buyers as the PCP moves forward. We will do this in 2 documents. I said this already a little bit. There is a starting, it's like a starter Pokemon. It's the starter version of the taxonomy that we have right now. It is the most basic version that we will keep working on, expanding it and sort of refining it to fit perfectly to the suHCO challenge. But alongside that, we will also have an Excel file where we're collecting all of the data sources, the protocols that are already available and usable for buyers as well as suppliers implementing or developing the solution. And finally, just to give you an idea how it will fit into the PCP process that you saw earlier, you can see there's working like the PCP process you just saw from Maria in the earlier slides. And under that, you have the working group activities and the sort of outcome of the working group. So once we are starting with the first phase of the PCP, we can start refining our taxonomy and then keep refining it and testing it alongside the prototypes. And finally, in issuing these white papers and working papers and collections of data sources and protocols to the public as we are progressing. Hopefully, as we are finishing the PCP, also having some sort of very tangible and robust result from our working group. And I think that is my last slide already. That was a quick one. And we're now open for the Q&A. I don't see. There's something in the chat. But that was Vinay. But nothing in the Q&A. But I do understand on a Friday, maybe you need to just digest all of the information you've received from us, and then see what you'll do with it. So Sonja, I think you have the last word.
Last warm word.
Yeah.
Yeah, I can also very well understand that people might need to digest, especially, and I repeatedly said that in the seat, my brain at least is also not working properly, I have to admit. Yeah, but feel free whenever something comes to your mind following this event to get in touch with us. You know how to do that. Yes, please do so whenever you think it is valuable for you and relevant. So last but not least, we wanted to tell you a bit more about what the next steps are for suHCO. Most importantly, the call for tender will be launched early July. So it is currently, the second version of the tender docs is currently with the European Commission and our experts that help us to improve these documents. So we look forward now to finalize the documents and publish them in early July. So watch out. I think, Vinal, you need to help me a bit with when the matchmaking and networking things will take place. I'm not sure I understand P0, P01. Apologies.
It's meant that phase 0 to phase 1, the activities keeps on going.
Sorry, okay, I didn't have the chance to look at the slides prior to the webinar. Yes, so it is obviously these are ongoing activities. So we have a matchmaking section on the suHCO website. You can also see the URL here on this slide. Go to that and then you will find the matchmaking section, and also a networking opportunity is always open. And you can get in touch with us via several means. The same is true for the Taxonomy Working Group. I think Marlene and also colleagues are happy to receive any questions, any suggestions, hints, whatever, in that regard throughout the whole duration of the project. Then more specifically in relation to the publication of the call for tender. So as I said, call for tender will be launched early July. We will have tender documents, information and training events throughout the summer until the call for tenders is closed. So we will organize a range of webinars where we offer suppliers to actually ask questions, give us the chance to present a bit more in detail what we are looking for, in addition to, of course, what is it's not in addition, it's, I think, complementary to what is in the tender documents. Tender submission deadline, I think this is not the correct date here. It is open until the first week of October. So we have extended it for, I think, 10 days, around 10 days, in order to give suppliers a bit more time to actually write on the proposals, because we know it is summertime and people will be away for holidays. That's why we extended the deadline a bit. Yes, and as I said, please get in touch if you have a question, a concern, if you want to communicate with us about whatever you think is relevant at any time. Also watch out the space on the website for the FAQ. There is already a lot in there that might answer many of the questions you have, maybe not all of them, but many. Yeah, and then a bit further ahead, of course, after we receive the tenders, we will need some time to evaluate the tenders. That will take place throughout October and November. Phase 1, where we further co-design the ideas, get a better understanding and a stronger collaboration between the procurers and the suppliers, will take place between December this year and April next year. Then we move with a lesser number of suppliers to phase 2, where we will where we will invite them to develop prototypes, and the procurers will test them with their stakeholders locally. This will take place from May to December next year. And last but not least, we have phase 3, which is the real life pilots with again only a selected numbers of suppliers, namely 2. And that will take place almost the whole year of 2028. So this is roughly what timeline for suHCO will be. Again, this is not everything is set in stone, but it will be roughly the timeline we will have to follow. Yeah, and I think that was the last slide, Vinay.
Yes, yeah, it is.
Okay, right. So again, if you have any question now, please speak up or write in the Q&A section. If not, we understand, of course. It was a lot of information. It is a Friday, it is warm, but yeah, please stay engaged. We would be happy, at least from our side, to hear from you, to engage with you, to understand it as a collaboration. And yeah, if there's nothing to add, I think we can maybe wait a minute to give people the chance to think a bit, but then I think we could close.
Seems everyone is
seems
just thinking.
Yeah.
Hopefully.
Everything was very clear.
Yeah. Take your time to digest. Have a good weekend. Stay cool in many respects. And yeah, I think and hope we will be in touch in the future. So thanks everyone for attending, listening, and also the colleagues for presenting. And yeah, good weekend, everyone.
Yeah.
Thanks, everyone.
Thank you so
Bye-bye.
much. See you soon. Bye.
Thank you for your time.